Hi, my name is Bill Hirsh. I serve as the Executive Director of the AIDS Legal Referral Panel in San Francisco. We were started by a group of lesbian and gay attorneys back in 1983 who noticed that their friends were dying of AIDS and they needed wills done. So a group of them put together a list of folks who were willing to run out to hospitals and do emergency wills for people who are dying very quickly. Over time, that list grew, and the legal needs of people living with HIV and AIDS grew, and that organization was started officially in 1989. We incorporated as the AIDS Legal Referral Panel. We have a long, rich history of association with the Bar Association of San Francisco, and we currently have over 700 attorneys who volunteer and take cases on behalf of our clients. With our volunteer panel, we're able to leverage over $3 million in donated legal services each year. So the grassroots model of the HIV system of care in San Francisco, that San Francisco model, is really alive and well in organizations like ALRP, where hundreds of volunteers each year donate their time and expertise to serve people with HIV and AIDS. And while back in the early days, a lot of what we were doing was simple wills, probably 85% of what we were doing, wills now constitute about 10% of the caseload at ALRP. And I share that statistic because I think it really speaks volumes about the legal needs of our clients and how they've changed over time. Now our clients are coming to us more with issues related to living with HIV than dying with HIV. The biggest issue for our clients these days is housing, and I'm sure that you will hear from many folks that housing is probably, next to medication, the biggest issue for people living with HIV and AIDS. The Bay Area is incredibly expensive to live in, and when you are living on disability income, it is very hard to afford to stay in San Francisco. So we work diligently to help people with HIV and AIDS stay in their housing, because once they lose their housing, it's very hard for them to get back into the housing market in San Francisco. We also help immigrants with HIV, and there are many, many people who are here in the United States who have incredible stories of discrimination and abuse that they've experienced in their native country, and they face the prospect of horrible persecution if they are returned to their country of origin. And we help them legalize their status and access the services that they need in order to stay healthy. We also provide legal assistance for folks who have problems with insurance law, and everybody I know has been jerked around by an insurance company, and it can be really overwhelming when you're sick to be able to navigate those systems. Insurance companies are really built on being able to wear folks down with multiple requests for information and appeals and interviews and assessments, and for people who are sick, it can be easily overwhelming. So we help people with insurance issues. We're also really dedicated to making sure that underserved populations within the HIV/AIDS community can access ALRP services. So we work diligently to get the word out to women, people of color, people with mental health and substance use issues, to ensure that they're able to access ALRP services. We also recently started a program which is unique in San Francisco, and that is an effort to help people with HIV who are receiving publicly funded services to access those services. Sometimes people are denied services and they need an advocate to help them navigate through the system of service delivery in San Francisco. So our HIV Consumer Advocacy Project is there to help people with issues around accessing services. I've been able to be at ALRP as the executive director for more than 10 years now, and every day I am impressed at the staff attorneys at ALRP and our volunteers who are out there every day helping people with HIV and AIDS stay in their homes, keep their jobs, maintain their income and health insurance, and make a huge difference in the lives of people living with HIV and AIDS. I think for many people, the issue of HIV/AIDS kind of waxes and wanes in terms of how present it is in people's consciousness. The unfortunate reality is that there are more people living with HIV and AIDS now than ever before. And in many ways, the needs that people have are more complex than ever before. And there really need to be an array of services available to assist people living with HIV and AIDS. It's not just as simple as taking a pill. So thank you for giving me an opportunity to share a little bit about ALRP and the work that we do and how we are kind of part of a history of an amazing community response in San Francisco, leveraging hundreds of volunteers in the community to meet the needs of people living with HIV and AIDS.